Hello everyone, today I'll be presenting on my policy topic, Abstinence-Only Curriculum in U.S. Public Schools, the Reproduction of Social Inequality in Low-Income Communities. Topics related to today's discussion of sexual educational policy surround the current status of abstinence-only education, comprehensive sexual education, teenage pregnancy rates, socioeconomic inequality, and the educational attainment gap. The guiding questions of this policy brief concern: how might the federal government redirect current funding streams for comprehensive sexual education? What socioeconomic background do the majority of teen mothers in the U.S. come from? What level of educational attainment do teen mothers in the U.S. achieve on average? And is comprehensive sexual education more or less effective than abstinence-only education in reducing teen pregnancy and preventing other sexual risk factors? In order to effectively assess what's at stake, we need to identify who's at stake. The stakeholders in this policy dilemma include all students, but more specifically, adolescent and teenage persons with bodies capable of childbirth, educators, administrators, parents, LGBTQIA identifying persons, women, low-income communities, ethnic, racial minority groups, as well as local and state governments. Statement of the problem. First, sex education is not compulsory in the United States. The federal government gives each U.S. state, and within them each school district, the legal jurisdiction to determine how sex education is taught, if it is taught at all. Abstinence-only programs emphasize waiting until marriage to have sex, purposely withholding information regarding contraceptives, STI and STD prevention, and other preventative measures. Federal funding streams under the Title V Abstinence Until Marriage Act abet the persistence of abstinence-only programming. Federal funds for these programs are granted to state and local governments as long as abstinence is stressed as the only effective way to prevent sexual risk. Health education curriculum, abstinence-driven or comprehensive, is often inaccessible or unequitable to students as standards vary by state and district set standards. A shared goal of both abstinence-only and comprehensive sex education programming is to reduce teen pregnancy rates. Teen birth rates in the U.S. are extremely high, at 34.4 births per 1,000 women ages 15 to 19. The federal government allocates $110 million exclusively to abstinence-only programs to address high adolescent and teenage pregnancy rates. Yet, the success of abstinence-only programming is limited. One study found that abstinence-only programs had no effect on sexual abstinence of youth. Another study found that sex education programs that utilized an increased emphasis on abstinence education were positively associated with state teenage pregnancy and birth rates, even after adjusting the data for socioeconomic status, Medicaid access, educational attainment, and ethnicity. Abstinence-only education certainly doesn't cause teenage pregnancy, but it is associated with it, which speaks to its ineffectiveness as a form of education. With reference to adverse socioeconomic effects and educational inequalities faced by teen and adolescent mothers in the United States, only 40% of teen moms obtain a high school diploma and less than 2% of teen mothers earn a college degree. A study comparing the level of educational attainment of teenage and non-teenage mothers found that, quote, teenage childbearing was associated with adverse early socioeconomic outcomes, such as lower high school and college graduation rates, lower wages, and increased likelihood of recipients of public assistance. In terms of sociological phenomena, the structural functionalist paradigm asserts that, quote, our lives are guided by structure informed by relatively stable patterns of social behavior found in social institutions which make society operate as a whole. Within this framework, educational institutions serve to socialize students, promoting solidarity and stability through state-determined and locally implemented curricula. In terms of the federal government's rationale for funding exclusively abstinence-only programs, the manifest or intended function of abstinence-only education is to teach America's youth to voluntarily refrain from sexual activity through abstinence and self-regulation as the most effective way to prevent pregnancy. The latent or unintended function of abstinence-only education relates to its positive affiliation with adolescent and teenage pregnancy rates. In accordance with social conflict theory, factors like social class, ethnicity, race, gender, sex, and in this example, teen pregnancy status, are all linked to social inequality. Teen pregnancy status as a social factor is frequently statistically associated with social suffering, as 63% of teen mothers receive public assistance and remain on welfare after their first child. Lastly, the concept of meritocracy, which is defined as a social system in success and status in life depend on primarily individual talents, abilities, and effort, a social system where people advance their bases based on merit. Without a high school or college diploma, there are less viable economic opportunities for teen parents who drop out or don't pursue higher education. Current policy approach. There are 2 federal programs that financially support the development of abstinence-only education. Under Title V, SRAE, and the discretionary SRAE grant program, $110 million worth of federal funds are distributed throughout the U.S. states through public and private donors to push abstinence-only sexual education. Within each state's local government, City Hall members deliberate on sexual health-related curriculum and decide the extent to which abstinence is stressed. Considering the U.S. does not have a federally mandated compulsory sexual education curriculum, a comparison between two state policies, one abstinence-only and the other comprehensive, is in order. First, the case of Louisiana's abstinence-only programming policy, Statute 17281, states that public health education, if it is taught, must be taught with the emphasis that abstinence from sexual activity is the way to avoid unwanted pregnancy and other health-associated problems. Statute 281 prohibits the mention of all contraceptives. On the other hand, in the case of California's Sexual Health and Accountability Act of 2016, Clause 51931B states that education regarding human development and sexuality must include education on pregnancy, contraception, abstinence, and sexually transmitted infections. California K-12 public schools must teach comprehensive sex education based on medically accurate information. It is not optional, but content standards are left up to local school districts. To combat the current ineffectiveness of federal funding streams for abstinence-only education, our policy alternative suggests the advancement of REA, or the Real Education for Healthy Youth Act, which would, first, federally define comprehensive sex education, ensure content within comprehensive sex education programming is medically accurate and age-appropriate, eliminate Title V, SRAE, and SRAE discretionary grants, and using said redirected funds for new federal grant programs exclusively in support of comprehensive sexual educational programming. Actionable steps are needed to advance the Real Education for Healthy Youth Act policy. First, the federal government must address current inadequacies in comprehensive sexual educational funding. Redirecting $110 million allocated to Title V and SRAE discretionary grants and eliminating said abstinence-only federal programs is necessary to create new comprehensive sexual education grants for new programming. Second, the federal government, with the assistance of the CDC, CSE advocacy groups, and abstinence-only education groups, must legally define what comprehensive sexual education is and standardize what CSE programs should have in their curriculum. Third, states that are granted and accept REA funding should encourage local districts to emphasize the importance of healthy sexual relationships, identities, consent, STD/STI prevention, and contraceptives. In the short term, states and local districts within them must pilot their newly implemented CSE program for at least a year. Fourth, to measure the perceived effectiveness of CSE programming, schools should administer a survey amongst local community members, school board officials, students, and educators on their attitudes regarding said district's programming. If program perceptions are largely positive, in the long term, further observation for at least a 5-year period is suggested. Program success in terms of its effectiveness could be measured with reported teenage pregnancy and birth rates within the state, local, district, and school level. Fifth, based on both the feedback from community members and research, new and adaptable program guidelines need to be adjusted and relaunched. Anticipated positive implications for this policy suggest that CSE programs fund creative, adaptive, and culturally sensitive sexual education programming, reduce the unintended adolescent and teenage pregnancy rates, improve educational attainment rates and future socioeconomic statuses for populations who under abstinence-only education fall victim to unintended teenage pregnancy, and assist students in K-12 institutions to have a well-rounded, comprehensive view of sexual education and avoid sexual risk. Conclusions and perceived limitations. Conclusions. Abstinence-only programs similar to Louisiana's are ineffective in preventing teen pregnancy and change is needed. The federal government enables said programs through exclusive grant funding. Comparatively, in California, under SHIA, comprehensive sex education programs are required of the state, which implies a highly unequal distribution of resources and knowledge about sex in the United States. Teen pregnancy, as an indicator of program effectiveness, shows that abstinence programs are both ineffective and enable the reproduction of educational and socioeconomic inequality amongst teenage parents, specifically teen mothers. In terms of limitations, incentivizing the federal government to terminate long-running abstinence-only programs and supplement said programs with drastically different, fairly liberal, comprehensive sex ed curriculum would be a challenge, considering there would be unforeseen expenses and other political-related problems. Additionally, if our policy was approved and effectively put in place, it is ultimately up to state and local governments in terms of what they emphasize in their curriculum. Also, the rigorous interview, appraisal, and workshopping process to make sure sex education curriculum is truly comprehensive within local governments is costly and long-term, where some states do not have the financial resources or time to support the implementation of new programs, considering we're coming out of a COVID-19 pandemic and economic recession. Lastly, even though students could opt out of sex ed programs, we anticipate that there would be negative reactions from both sides of the political spectrum regarding the comprehensiveness of their curricula and whether it is the responsibility of educational institutions to teach children about sex. Here's my contact information. My name is Elise Davis. Please email me if you have any questions. I want to thank everyone that's made it this far. I've really enjoyed researching this topic and I hope you enjoyed my presentation. Here are my references and a layout of the policy brief.